So, Dr. Kordasti, could you please summarize the talk that this morning was so informative for patients as well?
Sure. What we discussed today was basically talking about the immunopathophysiology or the role of immune system in MDS and how contributes to disease pathogenesis and also development of more malignant form of MDS in one hand, and the other hand how we can manipulate, if you like, or kind of change the course of immune response to use it in benefit of patients and prevent disease progression. The problem at the moment we have, most of the risk assessments are based on cytogenetic, the number of different cells in the blood or bone marrow, and therefore they are not directly correlated with immune system. Of course, they are a reflection of function of immune system, but we don't have as yet a prognostic scoring, if you like, for immune system. And this is important because nowadays more and more immunomodulatory drugs and immunotherapy are coming into picture as a therapy. And unfortunately, some of them, although being tried in MDS, weren't very successful. And we think the reason for that is that we need to reassess the risk of patients for progression and see whether we can include some of the immunological aspects to this risk stratification and therefore decide which patient is more likely to benefit from these kind of therapies. So
how do you assess that risk or that patient feature?
Yeah. It's a very important question. Unfortunately, we don't have a complete answer to that, and the reason is in past few years really is a very enthusiasm about identifying these risk factors, and we have published a few papers that showing specific elements which are important, which highlights the importance of ongoing research in different centers, how important is patients participate in these research, because gathering information about these patients and see how we can identify more important factors to identify immunological risk, if you like. I introduced a new test that we are trying to make it a diagnostic test for a subset of T cells called regulatory T cells, which may be a reflection of overall immune status of a patient. As a starting point, of course, is not enough, but maybe is the first step. And I introduced the concept, and hopefully we try to validate this as a diagnostic test as a starting point, and hopefully we will have more and more tests to come, and combining these information we would be able in a few years time or maybe earlier to have a better scoring system for the disease and have a better personalized therapy for patients, and using the new therapies that become available as immunotherapy or immunomodulation.
Thank you very much.
My pleasure.